Hi, I'm Sarah Novak, and I'm an associate professor in the psychology department at Hofstra University. And I also have the pleasure of teaching courses in the Masters of Public Health program. Today, I'm going to tell you about my research on romantic relationships and body weight. Now, if you're interested in public health, it is probably not news to you that we've seen increased levels of overweight and obesity in our country and throughout the developed world over the past few decades. A lot of health professionals focus on this increase in excess weight because of the medical concerns, because of the physiological consequences of excess weight. I agree that that's an important concern, but I come from a biopsychosocial perspective. So I'm interested not only in the physiological consequences of obesity and overweight, but also how does it function in your relationships and how does it potentially affect your psychological well-being? And as public health advocates, I'd encourage you to think about whether our health promotion might somehow undermine these other aspects of quality of life. Yes, we want to promote health, but we don't want to do so at the risk of jeopardizing social relationships and psychological well-being. To give you a preview of where I'm going in the studies that I'll talk about today, the first question my research asks is, how does marital satisfaction affect weight gains and losses over time? The second question flips those variables, so asking, how does weight status affect marital satisfaction? And then the third issue we'll address is whether couples are perceived differently based on their weight status. I like to think about concrete examples, so I bet you're all familiar with Homer and Marge Simpson, but you may or may not remember the Sprats. Do you know the old nursery rhyme that said, Jack Sprat could eat no fat and his wife could eat no lean, and so between the both of them, they licked the platter clean. Now, to me, that sounds like a really efficient division of resources, but some people might judge the Sprats, and they might judge the Simpsons differently based on their weight status. I became interested in this combination of relationships and obesity because, like many of you, I'm an interdisciplinary researcher. So I attend different conferences on different topics. So I would go to the public health or the obesity meeting, and I would see people showing graphs about the increased in prevalence of obesity over the decades. And then I'd go to my relationships conference, and I'd hear about the steady march downward as rates of marriage are declining over the same decades. Obesity researchers would emphasize this curvilinear relationship where individuals' weight tends to increase through young adulthood into middle age and then trends downward into the older years. Relationships researchers would emphasize the curvilinear relationship where marital satisfaction tends to trend downward pretty depressingly, precipitously through young adulthood into the marriage years, through child rearing. And for the marriages that survive, those who don't get divorced, we see an upward trend in later life. Morphologically, we know that men tend to be heavier than women. Psychologically, we see that husbands express lower levels of marital satisfaction compared to wives. So putting these patterns together, is it a coincidence, or could it be that marital problems contribute to weight gain, or perhaps weight undermines marital satisfaction? Meaning, are these variables meaningfully connected, or are these associations just a coincidence? Looking at the literature from an epidemiological or sociological perspective, several studies have shown that getting married is associated with weight gain, and getting divorced is associated with weight loss. But these studies come from a perspective of following people over years of time or even decades of time and simply asking, did you get married? Did you get divorced? Now, of course, lots of things change when you get married. Lots of things change when you get divorced. So to try to disentangle and try to start to understand the mechanism of how these variables might be associated, we need more data. We need to see not just marriage, are you currently married, but how satisfied are you in your marriage currently? And we need to see weight changes with quicker follow-ups than 2 years or 10 years, as the previous research has done. So that's a tall order because a lot of studies in coming from the relationships perspective will have great relationships variables and really neglect the health variables. But the health studies tend to ask the marital questions very poorly. Again, asking if you're still married, you must be happy in your marriage, when that's a pretty gross assumption. So I started to search a network to ask around who might have data to connect these variables in a higher quality way. And my networking led me to Benjamin Carney, who's a relationships scholar. He's currently at UCLA, but he had conducted a longitudinal study of marriage while he was at the University of Florida. And because of a fun coincidence, his wife is a nutritionist. He just happened to ask about BMI at every wave of data collection. And it happens to be that he's a very nice guy and very generous with his data. So I joined a team of collaborators to do a secondary analysis of this data to explore these questions. So his data is known as the Florida Project on Newlywed Marriage and Adult Development. Ultimately, there were 169 couples, newlywed couples, who completed the study. They were recruited before they even got married with ads in bridal shops and writing to people who had applied for marriage licenses. For all of these couples, it was their first marriage. None had children before marriage, and they were all heterosexual couples. And again, they participated within the first 6 months after getting married. So they were truly newlyweds. Overall, and because they were recruited from a university community, they were fairly young, fairly well educated. Many of them were students at the time that they entered the study, so they have low levels of employment. They were majority Caucasian, and thanks to, in part to being mostly students, their household income was fairly low. The structure of this study, it was 8 waves of longitudinal data collection. Participants completed questionnaires every 6 months for the first 4 years of their marriage. And at 2 time points, they actually came into the lab to interact and have a videotaped discussion. They were paid for every single assessment, which contributed to the overall high retention rate at 74%, which is excellent for a study that lasted 4 years with so many moving parts. Ben has a wealth of measures in his data set, but the ones that we're particularly interested in today, body mass index, calculated as you know, and as you're probably aware, body mass index has some problems as an indicator, which we can discuss during our question and answer period. We assessed marital satisfaction with the typical quality of marriage index, high face validity for this one. We have a good marriage, our marriage is strong. And we looked at some potential covariates, income, education, pregnancy status, depression. Each one of these variables could be a confound in the association between weight changes and marital satisfaction. We also looked at steps toward divorce and marital stress as potential mediators, helping to explain why these variables might be connected. So our question that we're asking first, how does marital satisfaction affect weight gains or losses? So if you think about Homer and Marge, if they're more satisfied in their marriage in the beginning, are they more or less likely to gain or lose weight over time? How do these changes occur? There's a wealth of research in health psychology and in psychology overall showing that marriage tends to be good for health. And particularly a good marriage is good for health. So a high quality relationship provides lots of benefits that can help with health regulation. People benefit from social support, having someone who's there for you when you need them. Also from social control, having someone who can help to regulate you, rein you in, help you make doctor's appointments, help you to eat more healthfully. A good marriage can also provide companionship to help reduce stress and promote healthy behavior overall. So from the traditional health regulation model, we would expect that couples should maintain or lose weight when marriages are satisfying. However, I found an alternative in the literature. This one's known as the mating market model. So this model is a little more economic in its perspective, saying that we only have so much time, we have to invest based on our priorities, and our priorities are going to be different when you're on the market versus when you're off the market. So if you get married and go off the market, perhaps you can relax and become more comfortable. But in an unhappy relationship, the partners might prioritize maintaining weight and appearance because they might need to attract another partner sometime soon. And so especially for couples who are considering divorce, they might not relax and become comfortable. They might prioritize going to the gym and eating very healthfully because that will help them to attract someone else. Whereas a couple that's very comfortable and relaxed, they might prioritize sleeping in and enjoying brunch together. So behaviors that are very positive for the couple, but might have a negative effect on weight. Just to remind you, we have 8 waves of data and many measures. So there's a lot of complex potential going on here. So we're trying to predict these changes in weight based on marital status. And this was done with hierarchical linear modeling and latent growth curve analysis using the SAS statistics program. So to simplify our results, we looked at your own marital satisfaction predicting changes in your body weight over time, and we saw a positive association. This means that the more satisfied the individual was, the more likely they were to gain weight over those 4 years of marriage. Next, we included a potential mediator, steps toward divorce. And it turned out that there was a significant mediation effect here. So your own marital satisfaction was negatively associated with steps toward divorce. Happy couples were not thinking about divorce. But for the less happy couples who were considering steps toward divorce, that had a negative effect on BMI, meaning the more you were considering divorce, the more you maintained or even lost weight over those first 4 years of marriage. Next, we considered whether your partner's marital satisfaction also helped to predict your own BMI, and it turned out it also had a positive effect, a little weaker than your own satisfaction, but going in exactly the same direction. So if you were happy or your partner was happy, you were more likely to gain weight over time. Finally, we considered another potential mediator, marital stress. So if your marriage isn't going well and you're experiencing a lot of stress, how does that affect your BMI? Well, it turned out it didn't. That couples who were more satisfied were experiencing less marital stress, but marital stress was not connected to body mass index, so it couldn't help to explain this original relationship where happier couples are more likely to gain weight. So I'm not going to challenge the entire literature that shows that a happy marriage has a lot of health benefits, but this current analysis shows that weight maintenance is not one of them. So instead, we found support for the mating market model, showing that priorities may vary with satisfaction and stability. So when you're feeling more comfortable, you relax and you behave differently compared to when you think your marriage might end. And I should point out that the weight gain that we observed is modest. We're talking 5, 10, 15, 20 pounds over 4 years, which is not a huge amount. But if these trends continue over time, that could increase people's risk for heart disease, for type 2 diabetes, and other potential consequences. So there remains an open question from this research, and I challenge you to think about this from a public health perspective. How do we promote happy, healthy marriages, and especially during these newlywed years, as people are renegotiating their habits, they have an opportunity to adopt a new lifestyle along with their partner, and to lay the groundwork and the foundation for raising happy, healthy children as well. Again, we don't want happy to compete with healthy, so how do we promote healthy behavior without challenging the satisfaction these couples enjoy? In our next analysis, we flipped the variables around. So this time we're asking, does BMI affect marital satisfaction over time? If your partner starts out slim and if your weights are similar, does that affect how satisfied you'll be later on in your marriage? Now, this direction is more motivated by the literature on weight bias. So as I mentioned, weight obviously has correlations with physical health outcomes, but it's more than that. It can also contribute to social functioning and quality of life. There's a huge literature that shows pervasive weight bias in many different domains, including education, employment, healthcare, and even interactions with strangers. To give one prominent example, regardless of your politics, you may have seen how Chris Christie tends to be treated differently compared to other candidates. Political pundits will openly think critical remarks on TV. For example, I heard a pundit say, "How could we possibly trust him to control our country if we can't trust him to control what he puts in his mouth?" Now, again, you could disagree with his politics, but that's a rude comment to make based on someone's weight instead of their ideas and their ability. And there's a lot of evidence that shows that weight bias, not just weight, but weight bias, the experience of prejudice and discrimination and these negative comments, can undermine mental and physical health. Now, my question, does weight bias occur in marriage? Does your weight status affect the satisfaction of yourself and your partner over time? Looking at the literature, the findings are inconsistent. There's some evidence that shows heavier women experience lower relationship satisfaction. However, heavier men have been linked with higher relationship satisfaction. And still other studies show no correlation between BMI and relationship quality. So we wanted to explore this over time and, again, potentially looking at gender differences. From a psychological perspective, we know that weight is correlated with perceptions of attractiveness, and this is more strongly correlated for women compared to men. And relationships research has been inspired by an evolutionary perspective, saying that partners think about mate value, what do you contribute to the relationship, and that women's attractiveness is considered to be more valuable to men than vice versa. And there are other perspectives like the social exchange theory, thinking about the costs and benefits that couples experience in a relationship. And so attractiveness, again, is seen as a valuable asset that someone could contribute, someone, especially a woman, could contribute to a relationship. We wanted to explore these relationships over time, thinking that maybe initial weight status matters more in the beginning and that dissipates over time. But our real innovation here is to not just look at the individual's absolute weight status, but to consider the couple, the dyad, in context, so comparing their relative weight status. Our couples, remember, they're pretty young and well-educated. They're also pretty low weight status. So there's some diversity here, but most people are in the normal weight category with some overweight and obese. Husbands tended to have higher BMIs than wives, but spouses' BMIs were correlated. So some evidence for either assimilation or assortative mating going on there. What did we find when we looked at each partner's weight individually? Heavier wives had higher satisfaction at time 1, but this decreased over time. And the wives' BMIs were negatively correlated with husband's satisfaction at time 1. However, we saw no associations with the husband's BMI for anyone's satisfaction. Now, what happens when we look at relative BMI? Again, instead of each partner in isolation, we computed the difference score, so subtracting the wife's BMI from the husband's BMI. So those who are hovering around the mean have similar BMI scores, and then we contrasted them with those who are higher and lower. So couples where the husband's BMI is significantly higher than the wives, and those where the wife's BMI is higher than the husband's, to see if that helps to understand what's going on with satisfaction. And it did make a big difference. So these graphs show the changes in satisfaction over time. The first thing you may notice is that marital satisfaction goes down for everyone. And as a relationships researcher, that's how we know our data are good, because that is the prevailing trend that we see in every study of marital satisfaction. You're as happy as you're ever going to be when you get married, and it's pretty much downhill for a long time from there. So it's sad to say that that's actually encouraging evidence that we're on track here. But the patterns are slightly different for husbands and wives, and we can see that there is some influence of weight status. So for husbands, we see a steady march downward, but the relative BMI makes a difference. So who is the happiest at time 1? The husbands who are heavier than their wives, and they maintain that difference over time. Whereas the husbands who are slimmer than their wives are the least satisfied at time 1, and they maintain that difference throughout the 4 years of observation. Now, looking on the right side at the graph for the wives, in the beginning, weight doesn't matter. And then we see that the results change over time in a pattern that mimics what's happening with the husbands. So there we see that the steepest declines in marital satisfaction are for wives who are heavier than their husbands, whereas the least decline is observed for wives who are slimmer than their husbands. As a researcher, it's somewhat shocking to find results that mimic the stereotypical husband and wife pairings that we see not just in animated TV shows, but on sitcoms on TV. So maybe there's something to it. Maybe these media execs know that couples where husbands are heavier than their wives tend to be more satisfied. But to recap what we found, we saw that couples where husbands are heavier show the highest levels of satisfaction and blunted declines in satisfaction over time. Now, I have to point out that this is relative BMI, not slimness per se. So we're not, bloggers tore us a new one as soon as this study got published. I'm not trying to contribute to the thin idealization and add yet another factor that women have to worry about, as though you cannot be in a happy marriage if you're not very slim. It's relative BMI. So a woman could be overweight, and as long as her husband is heavier than she is, she's contributing to our finding about satisfaction over time. And again, these results are descriptive. This is what was happening for this set of couples that we observed over time. It's not prescriptive. We're not saying this is how things should be. Now, we saw that wives' satisfaction appeared to be responsive to the husband's. So his satisfaction was different before hers was, and hers seemed to be changing after his. And we found that the relative weight association helped to reconcile that mixed literature. So the findings make more sense this way and fit with the previous theory. But the question remains, why does relative weight matter? So thinking about our male partner's weight and our female partner's weight, why do the different combinations matter? And I should say, although I've drawn these little silhouettes with a heavy husband and a slim wife, it could be the case that he is very muscular. Again, that's one of the defects in the BMI measurement, that it doesn't account for muscle mass very well. So he could be a different silhouette. But we're seeing these differences. Now, from a psychological perspective, it may be about intimacy or self-esteem and contingent self-worth. If you prioritize your appearance and you think that you're not a good person, if you don't fit a certain type, you might not feel good about yourself. You might bring that negativity into your marriage. I can think of lots of mechanisms within the couple. But I started to think about the social networks surrounding these couples, and maybe weight stigma continues to play a role. So the last question I asked, and this is work that I've done with some undergraduates here at Hofstra, are couples perceived differently based on their weight status? So would people look at Homer and Marge and Jack and his wife and judge them differently based on their mixed weight status? There's some provocative research introducing this term stigma by association, basically saying that the weight of someone you care about, the weight of people who are near you, can influence other people's judgments of you. So in some ways, weight bias can be contagious. So this provocative study showed that an average weight man was judged more negatively when he was sitting next to an overweight woman compared to when he was sitting next to a slim woman. And in one condition, they said it was his girlfriend. In another condition, they were just acquaintances. Either way, he was judged more negatively. So it's not just stigma by association, it's even stigma by proximity. And there's another strain of literature that explores marginalized couples' experience. So couples that are lesbian or gay, or have a large age gap, or are interracial or interfaith. These couples perceive less support from their social networks and more discriminatory behavior, even from people in their social networks who they care a lot about, family members and friends. So mixed weight status hasn't been explored, but I think it might parallel that finding. So the predictions here are a little bit complicated. So we're curious to know whether each individual's weight status influences perceptions of that target, but also whether the partner's weight status influences perceptions of that target. And finally, asking whether there's an interaction between the individual's weight status influencing the perceptions. And that's kind of a jumbly confusion, so let me break that down a little more simply. So we're asking, does weight stigma occur on an individual level? Is our male partner going to be judged more negatively when he's portrayed as heavy compared to slim? Or is she going to be judged more negatively when she's heavy than when she's slim? Stigma by association means that the person you're with is affecting the judgments of you. So is our male partner going to be judged more negatively when he's with a heavy woman, regardless of his own size, compared to when he's with a slim woman? And vice versa. Will she be judged more negatively when he is heavy than when he is slim? Or there could be a more complex interaction. Our participants were 470 undergraduates who participated for course credit, 148 men, 322 women. These are mostly pretty young freshmen, although there is a little diversity in age. In terms of race, BMI, sexual orientation, and relationship status, again, we saw some variety there, allowing us to explore these demographics as potential covariates. Now, instead of using the adorable silhouettes, we actually used photos of real humans that we then photoshopped to manipulate the different weight combinations. Now, I can't see you, but I bet you're squinting at your screen right now because our manipulations are pretty subtle. The heavy man is on the right side and the heavy female is on the lower level of these charts. Now, participants only saw one image. So they were not comparing side by side. They were presented with one image and then asked to rate their perceptions of the individuals. And we did pre-test this. And we saw that participants did perceive our slim female as significantly slimmer than the heavy female, and similar results for the man. So it's subtle, but people are perceiving the difference. What did we ask? We asked our participants to rate the targets, each one on a variety of different characteristics: how intelligent, how friendly, how confident, how attractive, how healthy, how exciting do you find this person to be? And all of these traits loaded onto one factor. So they were all, it's basically a positive trait rating. And then we asked about your intentions toward those targets. How much do you think you would like them? How willing would you be to get to know this person? And again, we included those demographics as potential covariates. Overall, we see a pretty consistent pattern of both weight stigma and stigma by association. Our female target was judged more positively when she was slim or when she was with the male who was slim, and vice versa. Our male target was judged more positively when he was slim or when he was with the woman who was slim, both for the positive traits and for the how much do you think you'd like them, how much would you like to get to know them. Next, we added in some of those potential covariates, explored moderation. Are there any interactions? And we did find significant interactions for the participant's gender, but none of the other variables had any sort of systematic influence. Looking at those interactions, if you look at the upper left corner, that one that does a complete crisscross X. So here we're seeing that the male participants are judging our heavy female more negatively, but our female participants are judging the slim female more negatively. So we can think about what's going on there. But the other graphs are incredibly consistent, showing the same pattern. So it's a small effect, but a very consistent effect where our male participants are judging the female participant or the male participant, female target or the male target more negatively if she is heavy. So the heavy female is being judged more negatively and is causing the male partner to be judged more negatively overall. So here we see some evidence of both weight stigma and stigma by association for positive traits and interactions. And we see that this is a stronger effect for the female's partner's weight, and compared to women, male participants showed greater denigration of our heavy female target and her male partner. This fits with previous research, and an additional previous study indicated that young men tend to be higher in bias compared to older men. So there's some encouraging evidence that this bias may decline with age. And again, we saw no evidence of interactions between the partner's weight. Some limitations should be considered. Our targets were young, white, straight, and dating. And if you think back to the marriage studies that I presented earlier, they were also young and predominantly white and all heterosexual. So those are limitations that go across all of these studies. But thinking through, would these results apply to other types of couples based on race, based on sexual orientation? Do we judge short-term couples differently from long-term? So we presented this couple as dating. What if they were married? Would they be judged similarly? Our participants were somewhat diverse, but they were all undergraduates in New York. They could be more or differently biased. Again, thinking about that finding for young men. And then how do we apply this to the real world? Does couple weight stigma have consequences for other more important processes? And how do we reduce that stigma? So a next step would be to look at the actual social support that couples experience from friends and family and whether their weight composition affects that. And thinking about important situations like, is a couple judged as suitable for potentially adopting children? So again, more real world consequences could be influenced by our judgments of their weight status. Taking these three studies together, we see that marital satisfaction predicts modest weight gain, potentially because the priorities are different for stable versus unstable couples. So we saw in one way, over time, happy may subtly undermine healthy, and we want to protect against that. So we need to find ways to examine strategies to promote weight maintenance without compromising marital satisfaction. The second analysis showed that relative BMI predicts satisfaction over time. So the finding there is that marriages are more satisfying when wives are slimmer than their husbands. And again, this begs the question of why. And so I pose one possible answer, that stigma and stigma by association could contribute to that effect, could undermine the couple's satisfaction if they perceive that others are more negative about their union. To use the parlance of the youth, haters, and especially young male students, will indeed hate. But this gives us more ammunition to try to combat weight stigma. Not only will it benefit individuals' mental and physical health, it can also help to support couples over time. Okay, that's the end of my studies, and I want to thank you for your attention, and I want to thank my collaborators, the students in my lab, and the Hofstra Faculty Research and Development Grant Program for supporting this work. And I've also presented my email address here, so in case you don't get a chance to ask your question, feel free to contact me at any point later on. But I'm looking forward to answering some questions. Okay, so we have a question here. You mentioned that a limitation of this work is that all of the couples are straight. So do you know if similar patterns would be found for gay or lesbian couples? That's a great question. And I don't know of any research that systematically compares gay, lesbian, and heterosexual couples of the same age group, same demographics, strategically. I don't know of that research, but there is some evidence that gay men suffer from eating disorders and body image disturbances at a higher level than their straight counterparts, and lesbians tend to have lower levels of body image concerns and eating disorders. So we need to take this approach of thinking about not necessarily your own gender, but also the gender of the partner you're trying to attract, the gender whose expectations you're trying to meet, and the influence that that might have. So I'd definitely like to see more research in that domain. Okay, the next question. In your marriage study, do you know if diet or exercise habits changed along with weight? Oh, okay. So that study was a secondary data analysis. So I was very lucky to get to that data existed, but I didn't get to help design this study. So we don't actually have variables about diet or exercise. I desperately wish that we did. So we can't. We're speculating that that's part of the mechanism that's happening as people are changing their priorities. Their health behaviors probably change along with it, but I couldn't test that empirically. Okay, the next question. How were the couples interviewed for marital satisfaction? Were they interviewed together or individually? Because the answers that they may provide in the two circumstances may be different. Absolutely, I agree. So privacy was paramount in trying to encourage people to be open and honest about something as sensitive as how their marriage is functioning over time. So they were. It wasn't a face-to-face interview. They were completing that measure on a paper and pencil scale, and they were separated while they were filling that out, so they wouldn't look over each other's shoulder or even, try to exchange glances. That was definitely a concern that was addressed in the research. Okay, well, I want to thank you again for your attention, and please do email me if any other questions or comments occur over time. I'd love to hear from you.